Gastrointestinal, Usmle CK Step 2. Patients present with sudden onset of severe diffuse abdominal pain. Exam reveal peritoneal sign and X-ray of the abdomen reveal free air on the diaphragm. The management is emergent laparostomy to repair a perforated viscus. Emergent laparostomy to repair a performed viscus. The patient have air under the diaphragm in the X-ray. That is a sign of a perforated viscus. Most likely cause of acute lower GI bleeding in patients over 40 is diverticulitis. Most likely cause of acute lower GI bleeding in patients over 40 is diverticulitis. The diagnostic modality used when ultrasonography is equivocal for cholecystitis is HIDA scan. HIDA scan. HIDA scan is the next modality when ultrasonography is equivocal for cholecystitis. HIDA scan. The risk factor for cholelithiasis is fat, female, fertile, 40 and flatulent. Fat, female, fertile, 40 and flatulent. This is risk factor for cholelithiasis. When you have inspiratory arrest during palpation of the right upper quadrant, this is a sign of Morphy's sign seen in acute cholecystitis. You have an inspiratory arrest during palpation of the right upper quadrant. This is Morphy's sign seen in acute cholecystitis. When you have the most common cause of bile obstruction, small bowel obstruction in patients with no history of abdominal surgery is hernia. The most common cause of small bowel obstruction in patients with no history of abdominal surgery is hernia. The most common cause of small bowel obstruction in patients with history of abdominal surgery is adhesions. Identify key organism causing diarrhea. The most bacterial organism is Campylobacter. The most common bacterial organism is Campylobacter. The recent antibiotic use is Clostridium difficile. If you have recent antibiotic use is Clostridium difficile, the most cause of the diarrhea. If you have been camping, is Giardia. If you have been camping, is Giardia. If you have been traveling, if you have traveler diarrhea, is enterotoxigenic Escherichia. Enterotoxigenic Escherichia associated with traveler diarrhea. Camping, Giardia lambdian. Recent antibiotic, Clostridium difficile. The most common bacterial organism is Campylobacter. Church picnics and mayonnaise is Staphylococcus aureus. Staphylococcus aureus associated to church picnic and mayonnaise. Uncooked hamburgers. Escherichia coli O157H7. Escherichia coli O157H7 uncooked hamburgers. Fried rice or uncooked rice. Bacillus cereus. Poultry eggs, salmonella. Raw seafood, Vibrio, and hepatitis A. Patients with AIDS, Isospora, Cryptosporidium, Mycobacterium ovum complex. Pseudoappendicitis, Yersinia and Campylobacter. pseudoappendicitis. Remember, AIDS patient Isospora, Cryptosporidium, Mycobacterium ovum complex. Raw seafood, Vivian. Poultry eggs, Salmonella. Fried rice, Bacillus cereus. Another case, a 25-year-old Jewish man present with pain and watery diarrhea after meal. Exam show fistulas between the bowel and skin and nodular lesions on his tibias. This is Crohn's disease. So remember, pain and watery diarrhea after meal. Exam showed fistulas between the bowel and skin and nodular lesion on his tibias. This is Crohn's disease. Crohn's disease. Enfermedad de Crohn. Inflammatory disease of the colon with augmentation risk for colon cancer is ulcerative colitis, greater risk than Crohn. Inflammatory disease of the colon with augmentation risk for the colon cancer is ulcerative colitis. It's a greater risk than Crohn's disease. Intrauterine manifestation of inflammatory bowel disease. Intraintestinal manifestation of inflammatory bowel disease. So, inflammatory bowel disease, they have extraintestinal manifestations. So, those extraintestinal manifestation of inflammatory bowel disease is uveitis, ankylositis, spondylitis, pyoderma gangrenosum, erythema nodosum, and primary sclerosing cholangitis. Uveitis, ankylosing spondylitis, pyoderma gangrenosum, erythema nodosum, primary sclerosing cholangitis. So the medical treatment for inflammatory bowel disease is 5-EASA aminosalicylic acid, 5-aminosalicylic acid agents, and steroids during acute exacerbation. A 30-year-old man with ulcerative colitis present with fatigue, jaundice, and pruritus. The diagnosis is primary sclerosing cholangitis. Primary sclerosing cholangitis. Difference between Mallory wales and Borehurst tears. Mallory wales is superficial tear on the esophageal mucosa. Borehurst is full thickness esophageal rupture. So the difference is that how deep or how worse is. So Mallory wales is benign. Borehurst is malignant. This is a totally broken and perforated esophagus, and is associated with a air in the chest, mediastinum air, or pneumomediastinum. So Borehurst is associated with pneumomediastinum. You're gonna see pericardium on the heart involved like in double air around the pericardium. So like when I say double, I mean double pericardium. You can see a pericardium and another layer of pericardium. In between you can see air. Borehurst tear. Okay, Charcot triad. The triad of Charcot triad is right upper quadrant pain, jaundice, and fever and chill. So this is Charcot triad. And then there's a renal pentad that is Charcot triad plus shock and altered mental status. So you have fever, jaundice, right upper quadrant pain. That's the Charcot triad. Then you add more altered mental status and shock. This is going to be renal pentad. Okay, so medical treatment for hepatic encephalopathy. Medical treatment for hepatic encephalopathy is diminution of the protein intake, lactulose, and rifaximin. Rifaximin, lactulose, and diminution of protein intake. This is a treatment for hepatic encephalopathy. The first step in the management of a patient with acute GI bleeding episode is to manage the ABC. When you say to manage the ABC, airway, breathing, and circulation prevent the shock. You manage the airway if the patient is conscious and you need intubation or not. You have to check the breathing. The patient is getting air in their lungs and the perfusion is getting done. And circulation, if the patient is getting shock, you're gonna need transfusion probably. So manage the ABC. So you have a 4-year-old child present with oliguria, petechia, jaundice, following an illness with a bloody diarrhea. The most likely diagnosis is hemolytic uremic syndrome caused by Escherichia coli O157H7. Hemolytic uremic syndrome caused by Escherichia coli. It's a little child with a oliguria, petechia, jaundice, jaundice following an illness with a bloody diarrhea. The most common diagnostic is hemolytic uremic syndrome caused by Escherichia coli. Now remember that Escherichia coli produces hemorrhagic bloody diarrhea. Okay, treatment after occupational exposure to HVV, virus hepatitis V. If it is not immune, provide HVV immunoglobulin and initiate hepatitis V vaccination series. Classic cause of drug-induced hepatitis. TB medications like isoniazid, rifampicin, pyrazinamide, acetaminophen, and tetracycline. There's a common cause of induced hepatitis. A 40-year-old obese human with elevated alkaline phosphatase, elevated bilirubin, pruritus, dark urine, and clay chloride stools. This is a biliary tract obstruction. Biliary tract obstruction is a obese lady, 40 years old, with an elevated alkaline phosphatase, elevated bilirubin, pruritus, dark urine, and clay chloride stools. This is biliary tract obstruction. So hernia of the highest risk of incarceration is indirect, direct, or femoral. Which one? Hernia with high risk of incarceration is femoral hernia. The femoral hernia is the highest risk of incarceration. Femoral hernia. Severe abdominal pain out of proportion of the exam. Severe abdominal pain out of proportion of the exam. This is as mesenteric ischemia. Mesenteric ischemia. Mesenteric ischemia give you a severe pain out of the proportion to the exam. Diagnosis of ileus. Diagnosis of ileus. Abdominal radiography. Could also perform a CT scan. So when you have an ileus, you can diagnose the ileus of the abdominal radiography. Could also be performed a CAT scan. 50-year-old man with history of alcohol abuse present with boring epigastric pain that radiates to the back and is relieved by sitting forward. What is the management? So this is sound like a pancreatitis. 50-year-old man with history of alcohol abuse present with the boring epigastric pain that radiates to the back and is released by sitting forward. This is pancreatitis. So what is the management? So confirm the diagnosis with acute pancreatitis with elevated amylase, and lipase. Make the patient's NPO and give IV fluids, oxygen, analgesia, and tincture of time. So colon cancer regions based on some symptoms. So if you have anemia from chronic disease, occult blood loss, and vague abdominal pain, you very likely have a right side very rare to have an obstruction. You have a right side colon cancer. So right side colon cancer is very rare to have an obstruction. And you're gonna have anemia from chronic disease, occult blood loss, and vague abdominal pain. It's vague abdominal pain, vague abdominal pain, vague abdominal pain, anemia from chronic disease, occult blood loss, right side colon cancer. If you have obstructive symptoms, change in bowel movement, you're gonna have a left side colon cancer. Left side colon cancer is description is apple core lesion. Apple core lesion, left side obstructive symptoms, change in bowel movement, colon cancer. If you have patients that present with watery diarrhea, dehydration, muscle weakness, and flushing, muscle weakness and flushing, present with watery diarrhea, dehydration, muscular weakness, and flushing. This is a vipoma or vipoma. Replace fluids and electrolytes may be needed by surgically reset tumor or use octreotide. So remember, big poma is treated with octreotide or surgically reset the tumor and use octreotide, vipoma. And patients with palpable, no tender gallbladder. Patient with palpable, no tender gallbladder. This is Courvoisier sign. Courvoisier sign is suggest pancreatic cancer. Courvoisier sign is suggested that pancreatic cancer is palpable, no tender gallbladder. When it's not painful, it's very likely it's a cancer. Thank you very much. This is all for now. GI.